Imagine saying goodbye to a loved one in the comfort of their own home, surrounded by the people and the things that they cherish. It's a desire that many of us have, but the reality can be daunting. Navigating the complexities of medical care, insurance, even the emotional challenges can feel totally overwhelming. But it doesn't have to be that way. With the right guidance and support, dying at home can be a peaceful and meaningful experience. Let's explore the possibilities together. Welcome back, Fading Memories listeners. This is Jen Fink, your caregiver best friend, and today we have a really super important topic. The title is a little daunting, perhaps, Dying at Home. It's a guide for caregivers. And before you click off and go, no thanks, I don't want to listen to that, this is a really important topic about getting hospice care, the why, the when, all the details. And trust me, having been through hospice twice, including once during COVID, I can tell you that they are a massive blessing at a very difficult time. So, with that, welcome to Caitlin Cassidy. She is a hospice social worker. Did I get that right?
I previously as a hospice social worker, now
Previously
I'm
was
a PhD student and a researcher.
awesome. So, I will let you better introduce yourself than I just did to the audience, and then we will talk about all the good stuff that you are researching and writing about.
All right. Thanks, Jen. Yeah, my background is actually as a hospice, home health, and hospital social worker, but mostly hospice. So I worked with folks actually in California and in Oregon, up in Oregon, and then also here in Michigan, where I am now, in hospice mostly, but also some hospital social work here and home health a little bit in Oregon. So that's my background. I study death and dying, and I also have been a caregiver on and off most of my life. I started as, um, when I was little, I was about 8, my grandma was still babysitting me, but right around 10, 11, 12 is when her dementia became too advanced and I started taking care of her. So by the time I was 14, 15, I was helping to do personal care for her. So I have a strong professional background, research interest. I've been reading and writing and also living. Today is my other grandmother on my father's side is her birthday, and she just died in July, finally just before 90 after many years of illness. And I helped my aunt care for her till the last day. So I have personal, professional, and research experience in dying at home. And I don't know, people not happy to bring it to folks, but I am happy. I'm happy to bring information to folks because it's needed and rarely talked about. So
Yeah, that's the puzzle to me, and the frustration is why this topic is still so taboo. I know culturally we kind of look at dying as a failure, which is just stupid. So stop thinking that, people. We're all, Circle of Life, Lion King. We are recording this the day after James Earl Jones died. My daughter loved Lion King. I am refraining from texting her that I'm sorry Mufasa died. But we talk about the circle of life. People say, "Oh, I want to die in my sleep. I want to die at home." They have all of these wishes, but then we don't help them put those in place, which I don't understand the disconnect. And so before we started recording, I was telling Caitlin, I have a neighbor friend who is caring for a dying spouse. The doctor has given them less than 2 months before the end and recommended hospice. And this neighbor is reluctant to pull that trigger. And as I was saying before we recorded, I have yet to be able to quiz him, for lack of a better term, on why he's waiting, etc. So we're going to use that example a little bit to kind of explain why we need to do things differently, because he needs the support, she needs the support. There's other people involved that probably need the support. So where should we start, Caitlin? So why don't we do a slight overview on hospice for people who might be confused or just haven't gone through the hospice process and
Sure,
might
sure.
have misinformation about it. Not that that's it's easy to have misinformation sometimes.
Yeah, so a lot of folks get confused between hospice and palliative care, and palliative care can be kind of a general term for just treating symptoms. So there's palliative care and palliative treatment. You can go to a palliative clinic. You might even have palliative care folks come to your house before you're done with aggressive or curative treatment for your chronic life-limiting illness. Even a terminal illness, you could be terminal and have palliative care and not yet hospice. When you're done with curative treatments, by and large, and your prognosis, as confirmed by one or two doctors, depending on the scenario, is likely 6 months or less with the natural course of the illness, then you are eligible for hospice. Hospice care is a whole team of professionals, a nurse and an aide who help with, nurses help with all sorts of stuff. They do dabble in the psychosocial as well because they're there so much. They're nurse case managers. They're there once a week, sometimes twice a week, sometimes even 3 or 4 times a week, depending on what's going on. And they handle medication reordering. The medications usually come to your house. The nurse will assess symptoms and changes, what's going on there, help you stay home and not going back to the hospital. The idea with hospice is to stay home or to stay wherever you are, whether that's assisted living. Some folks even have hospice in a nursing home, or if you want to call it a nursing facility. I know nursing home is a little antiquated, but I feel like everybody knows what I'm talking about when I say nursing home. And when I use SNF and other terms, they might not. So there's a nurse to handle lots of medical stuff and some education about what's happening in the dying process and what's going on, and to manage the case. There's an aide to help with personal care and bathing when that's needed. It's never necessary and sometimes isn't used until closer to the end. There's a social worker. There's usually an interfaith chaplain who is someone who can help navigate spiritual concerns. They may call themselves spiritual counselors. And they're usually folks who have trained to work with all different types of religions or even spirituality. Folks who say, I'm not religious, I'm spiritual. Just those existential and spiritual concerns at the end of life. And social workers, myself, use, we work with family dynamics, referrals, coordinating respite care, which is a benefit of hospice, where somebody would go somewhere for care and give the caregiver 5 nights of respite so they can get a caregiving break. And then hospice is on call, like we talked about staying out of the hospital. Hospice is on call 24/7. And so if something happens in the night, instead of calling 911, you call hospice and someone will usually come out, if not at least call and assess you. Now, that really depends on your area and your staffing and what's exactly going on with you, but that's the general gist. It's support at home so that you don't have to go back to the hospital. Sometimes people want to go back to the hospital. You
My
can
dad My
go ahead.
dad pulled that. He
Yeah.
was dying from kidney failure, and the toxins from the ineffective kidneys caused all kinds of cognitive issues. So at the end of his life, I had two parents basically with no memories. That was fun. Total sarcasm. And we had 24/7 caregivers. And unfortunately, he was a bigger person and insisted on spending his days in the sunken living room. So there was probably a 4 to 5 inch step up, and he fell. And the um, caregiver called, like, she didn't call, she called the non, maybe she called 911. It's been a few years. He died in
Mhm.
2017.
Yeah.
The paramedics came out to assist with getting him back into his chair.
Mhm.
They do their assessment. She tells him he's on hospice. My dad's like, I think I'm dying. I need to go to the hospital. Whisked him away. Poor hospice nurse is literally chasing the ambulance down the road. It was kind of it was very dramatic. But what was really beneficial is when the caregivers would call me with, and I'm not going to detail this because it's gross, but my dad had fluid in his legs
Mhm.
that didn't remain in his legs. Let's just leave it there. Which, of course, is not something that caregivers are generally equipped to deal with. We had one, because we had round the clock caregivers, we had one that basically had to go work somewhere else because she couldn't deal with the situation. they called me. My husband and I were out, doing errands, trying to have a nice lunch, trying to kind of unwind. And so that was kind of punctuated by this description that I'm not going to give you guys. And we talked to the hospice nurse, she talked to the caregivers, and everything got resolved. I didn't have to go racing over there. It
Mhm.
was about 15 minutes of, yikes, what the heck, a little bit stress. But then she reassured me that everything was handled, everything was fine, continue doing what I needed to do that day. It was such a relief because between my mom with advanced Alzheimer's and my dad, weeks away from passing, it was a lot. And I needed that time to take care of myself and my own stuff. So that's kind of one of the most dramatic examples of the benefits of hospice. My mom ended up on hospice at the very start of COVID. She fell, broke her leg. Most listeners know that. And I knew returning to the care home that she would need more support and the care staff would need more support. That was literally March 12th when she returned. And we already had hospice in place at that point. So I was all dialed in. And then we had the shutdowns and all the COVID drama that happened in March of 2020. So I did not have as much interaction with them. I don't think they had as much staff going into the care home and doing all their things, but she didn't need very much. And it was COVID. So, all across the board, positive experiences. Don't regret calling when I did, which kind of leads me. They try to put you into a window of 6 months till you pass. Why should somebody go earlier rather than later?
So my grandmother, who just passed, was on hospice for 2 years.
Hmm.
So I would say sometimes with kidney failure, with certain cancers, it's a much more stepwise process. You kind of know what's going to happen, 6 to 9 months, where those windows can be fairly accurate. But even with those diagnoses, and especially with other types of diagnoses, for example, heart failure, especially dementias, it is notoriously very hard to give that estimate. And that's why part of the definition, in terms of eligibility, is likely to cause death in 6 months or less. It doesn't mean that they have to. Some people are on hospice for years. So just because you go on hospice, and I think from Jen's example and my example, our personal examples, you can hear that you can go off hospice and you can return to hospice. So my grandma I'll give you my example. My grandmother went off hospice. She fell, she broke things. She went to the hospital. We contacted hospice. And then we decided based on, what the treatment that my aunt wanted for her and where she thought my grandma was at, that she wanted to go off hospice and have some treatment for a while. Now she went back on hospice, but she went off for a while, right? And so that's one of those myths of hospice. And so I want to say that starting earlier doesn't mean that necessarily that you're going to die in that amount of time. And on the flip side, it's 6 months or less, but a lot of people come in, I had clients that were on for 1 or 2 days. They just came on right at the very end, and we were able to get them that symptom control and get them a little bit more comfortable. But had we been there earlier, so this is one of the benefits, you get that support and you can get that symptom management, which isn't just pain control. It's sometimes, managing the side effects from the pain control, the constipation, the nausea, or those side effects from, the dying process and the disease process getting worse and going on as folks decline. And so that is a huge benefit because you don't have to go anywhere. And so I'll say that, having to go to the hospital or not being able to go to the hospital, that's one of the myths, that you'll die sooner if you go on hospice. I think that's another myth. There's been actually some studies that show that people who went on hospice actually lived longer than people who were matched to them in similar characteristics who didn't go on hospice. And people think it's because they had symptom management and better quality of life. Another one that I wanted to visit just before we move on is that you mentioned that your mom was in a care home and then with your dad, you had caregivers. Another
Mhm.
myth is that people think that hospice are caregivers. And once they go on hospice, sometimes they think people will just be there all the time. And, we wrote our book because that's not the case. So that because family caregivers are involved, and we hope that if people don't have family support, or even if they do, that they're able to hire people to come. But hospice isn't going to be in your home, 4 or 5 hours a day every day, unless there's a really special situation going on. And so that's another myth is that, that hospice provides, round the clock care or caregivers to you. That's something that often has to be negotiated with family or even hired on the side. And I think a lot of people don't know that.
That's probably true. The one thing I think a lot of people don't know, and I had forgotten in the 3 years between my dad being on hospice and mom being on hospice. So because my mom had fallen and broken her leg, she was mostly bedbound, and the caregiver asked me for incontinence products with the tabs to make it easier to get her in and out. And it was like, duh. Like, so
Yeah.
first off, the staff at mom's care home was looking out for my mom, which, yes, it was their job, but they did care. Thankfully, the hospice nurse was there because she piped up. I'm thinking, okay, let me go to Amazon, da 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 da. And I think I might have asked if I could get it at the Rite Aid because that was literally like two buildings down the block from the care home. And the hospice nurse happened to be standing there and she's like, oh, no, 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 we take care of all of that. I'm like, oh,
Oh,
that's right. Oh, thank God. I don't have to deal with trying to find the right product and get it here, blah, blah, Not that that was that big a deal. It was the beginning of COVID, so God knows what I would have been able to get. I think that was what was going through my mind.
sure. Yeah.
And they literally, when my dad was on hospice, before we even got home from the hospital, like within 24 hours, like, you guys must take training from the military or something, because, ma'am, it's like you get accepted on hospice and the mobilization is it's almost intense. Whatever you need a hospital bed, you need bedside, whatever medical, I don't, devices isn't quite the right word, but products, I
Medical
don't know.
equipment, durable
There
medical
you go.
equipment is
Thank you. Equipment
I
was the
mean,
word I
yeah.
was looking
Yeah.
for.
Yeah.
Whatever you need, boom, it shows up like Amazon could take a lesson. It's so fast and you don't have
Right.
to worry about it. You don't have to be like, where am I going to get a hospital bed and how much is it going to cost? And does Medicare cover it? And blah, like, psh, you don't have to worry about any of that stuff. And that's important. And my dad was on hospice for just shy of 2 months.
Mhm.
And it would have been longer, but I had issues with his personal nephrologist, which is a kidney doctor. She didn't think he needed to be on hospice. She thought I should drive him to dialysis and sit with him and, I don't know, hang my mother on a hook. It was very frustrating when I suggested hospice to her. And regular listeners know that she basically hung up on me. It's just, she's lucky she didn't walk in front of my car. But the point is it really helped me because I was still having to deal with the care staff and my mother and family because my dad's mom was still alive. She outlived my dad. There's just a lot. And whatever support you can get, please take it because that's what it's there for. So let's see. What kind of stuff, like, can you walk the listeners through? We did it. You described the different roles people play, and I've kind of described the onboarding process, for lack of a better term. Can you kind of describe what happens, like, especially if death's not as imminent? Like Jimmy Carter's been on hospice for, I think he's close to 2 years.
Mhm.
Can you kind of describe like the caring process? What happens? Because I know one person, their loved one was not dying fast enough, so they got, quote, graduated. They got discharged from hospice, which was actually kind of difficult because they lost all that support. And we need something. I don't know why they didn't call palliative care, probably because they were frustrated. But what is kind of the process that people should understand so maybe it's not quite so scary?
Yeah, I don't know that you can take I don't know how easy it is to take the I don't want to say the the trauma or shock of like graduating hospice away. But I think if you understand that there's a process behind it, being that when folks are on hospice, they have certification periods with Medicare or with their private insurance or with Medicaid. And so the doctor, who I didn't mention, who's on the team, but you don't see very often usually, the nurse is constantly consulting with them. The hospice doctor will have to recertify them. And sometimes it happens that people just aren't declining. And, they just say, hospice says, we can't, Medicare's not going to pay us for this anymore. They just didn't decline as we expected because no doctor, no nurse, is the almighty and can really predict, what's going to happen, to the day or the hour or even the month. And sometimes people really surprise us. That being said, people say my grandma was on hospice. Had we not taken her off, she would have declined and stayed on hospice. She would not have graduated and had to, go back on. There was a point where they said, maybe not, but we think we can certify her or recertify her and she's still appropriate. And her week to week care for those years looked like a nurse coming once a week, a chaplain coming once a month, and a social worker coming once a month, an aide coming 3 times a week to help her have a bath, to get her to the bath and bathe her. All the products coming, they ordered the medical equipment was there for the most part, but they ordered, the briefs that she needed, either the kind that you pull up or the kind that have tabs later on, which they also provided us. And at that time, that sort of routine, when somebody can be fairly stable or is declining really slowly, you don't necessarily see a lot of hospice support in the house all the time. Even though they're always there. And that time is where a lot of it's either hired caregivers or somebody at home. That doesn't mean the person doesn't need care,
Right.
for some people, they can't be alone. They're not safe to be alone anymore. So somebody's got to be sitting with them all the time. Now, hospice also does have volunteers. That's been a staple of hospice since it started. Before it was even, everybody used to be volunteers back in the 80s. And then what happens sometimes is a hospice has a volunteer that can come and sit with someone for a period of time while the caregiver leaves and does what they need to do. And volunteers do provide that service in some places and are able to stay with people depending on what their needs are. But, day to day, if someone's on care for a while, it doesn't exactly look like, it's not exactly pervasive, hospice is there all the time. And I think, people want more support, but I would say there's also a subset of people, Jen, that, maybe like the person who's reticent, who you mentioned at the beginning, that just are much more private and they don't want people in,
It could be.
like
I'm not, like I
they
said,
don't
I
want
haven't,
people in their home like that, right?
excuse me, I had a tickle in my throat.
I understand.
Like I
And
said,
so,
I haven't been able to like quiz him and, get behind all the, it's like I really want to help, but I obviously don't want to take away the little bit of respite they have in the afternoon by going to the dog park. I guess I could say that much. So I don't know what the reticence is, but he's not the first person that I've talked to that is resistant. So my mom died March 31st, 2020. I was in an Alzheimer's support group. Another member lost their person later that summer in 2020. And I think because of COVID, their hospice journey wasn't as smooth as mine. And like I said, I've done it twice. But I feel very certain that they were part of the problem because they were very resistant. They felt like calling hospice was equal to pulling the plug.
mm,
And it was so frustrating because
yeah,
we went
yeah.
from in-person meetings to on Zoom. And so we all lived in the same town. And it's like I wanted to drive over to their house and just shake them like, this is what both of you need. I just went through this. Like you could have asked me. So it's not an uncommon feeling that calling hospice is like giving up. And I don't know how we start to help people not feel that way. I don't know. Do you have any ideas?
Well, I mean, I think talking about it more and more and sort of trying to dispel those myths. One of the things people are afraid of is that you won't be able to see your doctor, which isn't always true. Sometimes your doctor will follow you on hospice. Um, they're afraid they won't be able to get care for other things. My grandmother got shots in her eye for her glaucoma for a long time. Conditions that aren't related to your hospice diagnosis or whatever the terminal diagnosis is can usually still be cared for and paid for by insurance. And so that's another one of those fears. And so dispelling those fears, but I think just making it, normalizing it, and this is important to just to talk about it more. We won't talk about hospice. People don't want to say the word, or people don't want to say dying, or people don't want to say that somebody is dying or is going to die, or talk about what might happen when we're close to our own deaths. And I think that talking about it, even though it sounds simple and kind of silly, sort of starting to change that cultural norm is a big deal to me. For me, then that's part of the work that I do in my own family, and with folks that I've worked with. We did have, that COVID experience was real, and we did, in the book, we had, when we added, this was an updated edition that we just came out with, of Dying at Home. um, and Dr. Sankar had so many, she's the original author. I came on as a co-author. She had so many examples, and that's what I think really makes the book good, or like hearing examples of how caregiving looks for someone who's dying at home, and all the different ways it can be. And we did add in this edition someone who really just still felt alone, even though they had hospice, because they had that COVID experience of nobody really knew what to do, and they had hospice support, but it didn't look the same as it usually did. And that sense of being alone. And one of the things that we, talk about is not trying to do it completely alone. And I think that's another thing to sort of, answer your question about how do we do this, is to say to people, don't do it alone. Hospice is not a death sentence. You can revoke hospice.
Hmm.
You can meet them and talk to them. I mean, I think that one of the harder parts for me about hospice being a for-profit is that it's like a business, right? But
Hmm.
there are some silver linings of that. Like, if you are in an area that has a lot of hospices, you can ask to meet them and see what they do. You can be a consumer of it, and interview different places and see, just how much support, they have. Different hospices. Hospice is only required to provide a certain basic level. They're not required to provide music therapy or massage therapy or pet therapy, but some of them do have that. So I think to emphasize it as, another level of support, and nothing that's a signed, warrant or is ever sure. It could be 2 days, it could be 2 months, it could be 2 years. That happens. People surprise us all the time. But if it is shorter than you think it's going to be, and you have that support in place already, it is monumentally easier to keep someone at home if those are their wishes.
The thing that I benefited most from, mostly my dad's hospice, because I didn't interact with moms because of the COVID restrictions. And it literally was the very, very beginning. Quick aside, I loved the company that we used for my dad. So when it was obvious that my mom was going to need more support, I called them, and they must have been overwhelmed. They are a not for profit, just bought some stuff at their thrift shop a couple weeks ago. And they would call it, there basically was days between voicemails, and we would miss each other. And I finally had to go with the company that worked with the staff at the care home, and they were
Mhm.
fine as well. Like I said, I almost didn't see any of them. I'm pretty sure they didn't send the chaplain and all those other things, which was fine. We didn't need all that. But what I got with my dad is explanations on what was going on. And you were talking about continuing certain treatments. My dad was obviously diabetic, and my sister was very adamant about continuing his insulin, which was a bit of a problem because the care staff was not allowed. I don't know if it was their rules or the laws or whatever, but they were not allowed to inject him, which is fine because he probably would have been ugly about that. And I understood her wishes. You know, if your blood sugar's out of whack, you feel like garbage. That makes sense. So, not having him feel like garbage was important. Not having to deal with insulin was kind of important as well, but him feeling better was more important. So they worked with us on that. It was not
Yep.
easy. And they just kind of explained, as when you have kidney failure, you don't usually last more than a couple weeks. I forgot to include my family is like all kinds of stubborn. So he lasted much longer than anybody expected. So they kind of just walked you through that. When you had a question like, what the hell is going on? I don't understand this. They would talk to you about it. And just that, information, that support, it was kind of emotional, but it was emotional through understanding the process, just made the whole thing so much easier because, as after we got past 2 weeks, you kind of Google diet of kidney failure, and they're like, yeah, they generally go in 2 weeks, but they can last longer. And it's like, but they didn't describe lasting longer. It was like, now what? So it was very beneficial to have somebody to ask and avoid Dr. Google, which is not always the best way to get your information. So, how do we help caregivers? I know it's much harder to get it's not harder to get somebody with dementia on hospice. It's harder for them to know, is it 6 weeks, 6 months, 6 years, the person that was discharged from hospice. Now they must have gone with a for-profit company because they had the massage therapy, the music therapy. I'm like, why did my dad not get any of that? I don't
Not
know that
always
he would.
necessarily a for-profit company. Sometimes they're just more
Oh,
established, right? It just
okay.
depends on,
Well, they got all that. I didn't even know that that was a thing until they shared that experience. So of
Right.
course it definitely was a bit devastating to suddenly lose all those benefits and all that support,
Mhm.
but it's just really hard to know. They're on hospice again because it's been a little over a year since they were discharged. So, it was a long time. They were on hospice for 9 months. So 2 years later, thereabouts, she's still with us and she's still somewhat verbal. And for somebody in advanced Alzheimer who's bedridden and all that the end stages brings with it, it's kind of surprising. And I think this gal is going to talk to the end. That might sound morbid, but it's interesting because my mom talked less and less, especially the last couple weeks after she broke her leg. Just was not, she wasn't present with me at that point, which was okay because I wasn't allowed to be there. So, how do we help people understand like what support they're going to get? Like, what's the important like nugget from your book that you want to share with caregivers? That might be easier. Maybe it's harder.
So I think that Dr. Sankar's, sort of overall message, I guess, was that people shouldn't do it alone. They shouldn't try to do it alone. And so I think that hospice is a major it is a major support. There are other supports. There are area agencies on aging. There are obviously placement options, care homes. I don't know if they still call them board and cares in California or what they call them. We call them adult foster homes out here, AFC. Um, and there are caregiver groups, and finding all those supports and marshaling family or your faith community or your friends, and to not do it alone was her message. My message in terms of making a commitment to take care of someone where they are, whether that's a care home or in their home or wherever that is, to decide you're not going to go back to the hospital and you're not going to move them, is to just be okay with not perfect. So I don't want to say lower your expectations, but to give yourself and to give the person some grace when things don't go exactly how you planned or exactly how you wanted. Some people have very specific plans for how they want. And when they think about having a death at home, like, oh, so and so is going to come visit and we're going to be able to gather around, and they assume that, maybe the person's going to be now not, most people with Alzheimer's and dementias are nonverbal by the time they get on hospice. There's a very specific set of criteria that folks, because it's so hard to predict dementia, usually have to have. Now, if they're verbal, then that probably means there's a lot of other things they can't do, like get up or feed themselves and all these other, or, personal care, any toileting, anything like that, right? So they have to like not be able to do really anything else if they're verbal. And so it's kind of a combination of those things. But even folks who don't have dementia sometimes just aren't talking at the end. Like you talked about, one of those things, what do we expect now? And that huge component of hospice being education and re-education, because when people are going through something like this and losing someone, sometimes they just don't hear it the first or second time. And so hearing that, hearing where they are in the process, hearing that, you might have thought your person was going to stay alert and oriented, and you were going to have all these folks visit, and now they're just not up and talking. And that's a normal part of that progression of the dying process. People will stop socializing as much, not like my grandmother didn't, which is why nobody really thought she was going to go. And I was sort of like going out of my mind, like all the other signs, are saying she's going to go quickly. I'm so worried about making sure we have support. But sometimes, sometimes people just kind of do what they've always done right there themselves. Like you said, that lady is going to talk forever, but a lot of times they stop, and that's not somebody's, it's not the more, I guess I want to say, kind of romantic vision that people sort of assumed would happen, or they wanted to keep them at home, but they had a break, they've had a fall and a break, and they went back to the hospital, and maybe, or they decided they couldn't do it. Someone's trying to care for someone at home, and they decide that they just can't do it. They don't have enough support, or that's not the type of person they are. They can't sacrifice their family or those relationships, and they have to have someone placed. All those things are okay. Doing your best is okay. And that's my nugget that I give to caregivers. Now, I don't, insofar as is there one like nugget of information that you can get, this like key or Rosetta Stone that like unlock making this easier? I don't think that exists.
Probably not. Everybody's different. The
You
one
know,
thing that go ahead.
no, I think that really that's sort of what my nugget is about, is just sort of accepting that it's not going to be perfect. It's not going to be exactly how you plan it. Some days you're just not going to feel like you're doing it well enough, or you're doing it right, but doing your best it's kind of always like that. It's almost never perfect. It just isn't.
Life's not perfect. So my nugget that I would like people to take away is understanding the dying process will make the whole thing so much easier. My grandfather, my maternal grandfather, died from, unfortunately, bone cancer. And my aunt, his youngest child, could not accept, and she's not the only one, this other person that I mentioned whose loved one passed during the summer of the pandemic, could not accept the natural state that they stop eating.
Mm-hmm.
And now my grandfather died in 99, and I don't know why he was on a feeding tube. That's not a good thing, in my opinion. My aunt would overfeed him, which would cause other issues that we aren't going to discuss because people they might be squeamish. Let's put it that way. And this other person was so freaked out. And I use that term specifically because that is how it presented. Just like he was not drinking or eating, and this person literally shoved ice cubes in his mouth. And it was like, I really
Hard.
felt badly that we were in COVID because I think she really, really, really needed somebody to just step in and kind of take over, because she emotionally just she was not she was not helping herself or her spouse, and it was really, really, really painful to watch her reaction through Zoom. Like the worst Zoom experiences I've ever had was because I don't think she knew. And she would have benefited so well from hospice. I mean, they did have it at the very end, but I'm not even sure he had it for 2 weeks. It was
Yeah. So
very, very
yeah, I
short.
think that you're right. I think that no, I want to back up. Like, I don't want to say there's nothing that make it easier. There's a lot of things that make it easier, which is why we wrote the book. There's nothing that makes it easy. Okay. Like, so there's no like, one like panacea, I guess. I do think that that understanding, and like you used a key term when you explained that, you said accepting. So there's two different points to that, right? So hospice can come in and educate all they want, and sometimes denial stands right up in that person's heart, soul, and mind and says, that's not what's happening here. I'm not losing them. That's not what they're going through yet. And that's when and I would say, for myself in hospice and other folks that I've worked with, that's when we struggle watching that too. But they need to eat, And we say, no, this is a natural part of the dying process. This is actually better for the body to stop eating and even to stop drinking. This makes it much easier in some ways, and it's not painful. And you can say that until you're blue in the face, and that person can still go, but that's not what's happening now. So I think that, that the emotional support components, and I think also getting on hospice earlier. And
Mm-hmm.
I will say that, which is something that I've said more in interviews and isn't, maybe I think it's explicitly stated in the book, but not as a do this, request this thing for me, is to request, if this is what you want, open and honest communication from your physicians. Request or demand that they are open and honest with you about you or your loved one's prognosis, about what they think is going to happen, about what a process is going to look like. What is the next? You say it's going to be a year. What is that year going to look like? What do you think? Tell me. I think also asking people, which is a dirty trick, but I would do this. What would you do if it was your family member? And really asking for honest, open communication from your care providers is big before and after hospice. But I would say even before hospice, when you're thinking about treatment, because that'll also tell you if you need to find a new provider, if you need to find a new doctor.
This particular person's their spouse's general physician, I think their care provider, I don't know if it was the GP or not, I think it was,
Mm-hmm.
did tell her, I think your husband has about 4 months.
Mm-hmm.
I'm pretty sure that they've experienced it enough, but she was offended and angry that he would say that. And I
Yep.
thought, oh, this was bad. So July, June, May. Yeah. So they were told that maybe right prior to the pandemic or at the start of the pandemic. Maybe it would have been beneficial if this physician had said, I think he's got about 4 months. This is what the next 4 months would look like. I don't know. I don't know what her reaction was. That might not have been an option, but I agree with the physician should kind of explain it. Maybe if she'd at least heard it from him, and I'm not saying that she didn't. I don't know. I'm assuming she didn't. She did not hear it, whether it was stated or not. Let's put it that way.
Yeah.
And but if she had heard it then, and then maybe again with those of us in the support group who were pushing for hospice, you really should do him this I don't want to say favor, but like you need to do this for him. This is beneficial for both of you, blah blah blah. You've probably said those words a zillion times. Perhaps if she had heard it multiple times, she would not have waited quite so long, because my mom's passing was pretty peaceful. My
Mm-hmm.
dad's was a little bumpy in the last week. Thank God we had hospice because they navigated all that. If we hadn't had them, it would have been ugly. It would have been ugly for him and it would have been ugly for us. And I just don't want anybody to leave this earth in that fashion. Well, maybe there's a few people, but regardless, we don't want our loved ones to suffer. So, yeah, the education. Unfortunately, there are people that are starting to share hospice information on social media, which they got to do carefully, but it's hopefully their education is helping. And, people like you have written this book. So the title of the book is Dying at Home. It's a guide for caregivers.
Yep. The title of
Oh,
the book is Dying at Home, and it is a family guide for caregiving.
oh, I almost remembered the whole title. Listeners know that I always link books in the show notes, so you can just click on it, click on the link, go right there. I personally think, if you're in the midst of caring for somebody with Alzheimer's or other form of dementia, pick this book up, maybe read it, in little pieces. If you're in the middle stages or entering the later stages, get educated now. And that way, when the time comes, you're not trying to play catch up. And you could take it very slowly in very small pieces if necessary. Or you can read the whole book all at once, whatever floats your boat. But I
Yeah.
just, having been through this experience, having dealt with people who have fought the experience, I feel like I can speak from the heart and say it's in everybody's best interest to take advantage is maybe the wrong word, but to use the services of hospice. Medicare does pay for them. I do know a caregiver who I think their person fell and they said, that's it. We're going off hospice so we can go to the hospital. That was a whole thing. They thought the person wasn't going to live very long, and they have had the most fantastic summer with their loved one. So I don't know if they're back on hospice or not yet. Probably not. They're a little bit unsettled as to where they're staying. They basically spent all summer traveling. And what a gift to give to the loved one. And when the time is right, they will go back on hospice, and they've experienced it before, so they know the ins and the outs. And hopefully, more caregivers will speak out about hospice and the benefits, especially for those of us caring for somebody with some form of dementia.
That's another myth, by the way, Jen, that you can't travel when you're on hospice. I, as a social worker, had to set up all sorts of things for folks to be cared for by other hospices when they were going to go visit their family. So,
Well, I'll mention that to them in case they were unaware of that. They, like I said, they went off hospice because they just did not feel it was quite right at that particular situation warranted a different path, which warranted going off hospice. So it was their decision, and they'll decide when it's right to go back. But, you know, it's like we said in the beginning, calling hospice is not giving up. It is not a death sentence. And then you pointed out that there have been studies that looks like hospice may actually extend living and hopefully fairly good quality of living. So don't hesitate to read the book, to call hospice. Maybe I'm assuming that if you called around to your local hospice providers and
mhm.
asked general questions just to get educated, I'm sure they're totally fine with that, correct?
Yeah, absolutely.
I mean, if
Yeah,
they're
I
not,
mean,
don't
some of
call
them
them
even
back.
have people they'll send out to meet with you. It just depends on like the kind of hospice. There are people like, hospice I worked for had hospice consultants, or they call them all sorts of different things, where if you want to know about hospice, they will send somebody out to meet with you and discuss it. So it really, really depends on the hospice and where you're at. But yeah, absolutely. They're very, very used to answering questions, whether they're called a community consultant or some sort of navigator or whatever. There are almost always people to, and even, even if you don't have a lot of hospices locally, if you're in a rural area, you can call your local big area and just, you don't have to tell them, where you live or anything. You can just say, you have questions about hospice. You can, so you could call a different one. Yeah, it doesn't, they're very used to giving informational visits and answering questions. Absolutely.
Hey, your response reminded me that I actually talked to a hospice provider while my dad was in the hospital. And I was trying to basically I was getting information because that's how I work. Like I need to know all the ins and outs, the whys, the wherefores, and then I can make decisions. I don't want to make decisions in a big panic. That's dumb. My sister found out I was trying to keep it from her because I knew how she was going to feel. She's like, we're not at that point yet." And I'm thinking, maybe not today, but we're dang close. And we were there. I just had to bring her and his nephrologist along with me, and because he did not want to do dialysis anymore, and she knew that, the nephrologist. So I had to deal with them, and then when he fell, and I had him go to a different hospital, and their nephrologist, she explained all this stuff to me, and I finally said, I just think it's time to call hospice. And she's like, okay. And I was like, oh, thank God. That's the biggest relief. 30 minutes of trying to explain all this medical stuff to me. And then they had to call and do it with my sister because I'm like, there's absolutely no way I can repeat all this and answer her questions. And they were happy. I couldn't believe they were happy to have that conversation twice. And then when I said, this is what he wants, they're like, okay, that's great. I'm like, okay, wow, this was so much easier the second time with different doctors. So, the more information you have earlier, the better. And that's why I bring people like Caitlin on and promote their book, because we need as much information as we can, because that is the only way we're going to navigate these journeys with as much ease as possible.
Well said, Jen.
Thank you. Well, so thank you so much for joining me today. And I hope the listeners got good information out of this. I think we shared enough good stories that I hope they can relate to at least parts of some of the stories. And
Yeah.
like I said, the book is linked in the show notes. Definitely check it out. I'm sure it's not depressing. It's just good information that you guys all need to know. Fading Memories is also available wherever you get your podcasts.